There are some people that are even asked to stop having sex when they're approaching their EDD, the expected date of delivery. So you have to also ask, is this safe? Hey guys, so today we'll be talking about nipple stimulation, in conjunction with labor inducement. Now, many of us don't even know that there is such a thing as nipple orgasm. The other time we talked about clitoral stimulation, and today we'll be looking at nipple stimulation. Alright, so see, let's tell ourselves the truth. I mean, let us be civil with each other.
Continue.
Many of you men love to suck breast. And you cannot escape from this truth. I mean, it is not fiction, it is not lies, it is proper truth. Many of you men love to suck breast. You want to touch breast, you want to feel the nipples, you want to touch the nipples and see your woman, react as you touch the nipples. So that is the reason why some people till tomorrow, when they see big breast, when they see nice shaped molded breast, they will turn twice. Turn. Yes, I think I've seen some men turn around because some ladies in somewhat manner curvy and molded walk past and they were like alright, so let's go to the chase. Now, for the fact that most of our men, they love breasts, it cannot be overemphasized, they love it. And since they love it, and the other way around, the kind of antenatal services given or rendered in most hospitals is nothing to write home about, and some knowledge that is supposed to be dispensed even in antenatal clinic. Most antenatal clinics in Nigeria is nothing to write home about. They don't talk about stuff like this. Some they just jump it. Now, some high-risk pregnancies, in other words, or in simpler sentence, some pregnancies that need more attention than other normal pregnancies, like pregnancies that are likely to come with or to end with complications like placenta previa and certain bleeding disorders, and situations where the baby will have to struggle before she comes out. Those kind of pregnancies are high risk pregnancies, and those kind of pregnancies have to be taken, have to be put into certain considerations. So if at all you are in that category and your husband unfortunately loves to handle your breasts, dear husband, as far as this lady is pregnant, you should not handle the breast in the way you want. You should not whatsoever have try carrying out nipple stimulation or trying to have her reach nipple orgasm. So if you are a master at caressing, stimulating the nipples with your fingers, with your tongue, with any instrument that I don't even know of, new things come out every blessed day. In fact, every blessed hour. I am so shocked. If you are that type of man, you may have to desist from any form of nipple stimulation or desist from making your wife reach any form of nipple orgasm. You're welcome. Alright, so the reason why this is encouraged is because stimulation of the nipple, especially when the woman is approaching the 40th week. When the woman is approaching the delivery week, or 2 weeks to the delivery week, or a week to the delivery week, such woman is delicate, and of course, nipple stimulation can only bring about a situation where there is release of oxytocin, and because the body or the uterus is already giving signs and giving signals that, oh, this baby is meant to come out anytime soon, hooray, oh, we are gonna be free again. Then the kidney is gonna be like, yes, at last, I have been so crushed here. Then the lung is gonna be like, man, it's been a long time I expanded. And so if at that point you engage this woman in nipple stimulation, what is going to happen is there is going to be inducement of labor. So even if that moment, that week, that day is not her EDD, she may actually, start having contractions. Strong contraction that will lead to delivery that you never planned for. All right. So now, for people that are high risk pregnant women, people that have high risk pregnancies, it is not encouraged, because it may, the body science can be so crazy. It can be so crazy. It can just do things that you never expected it would do. So you are, engaging this woman. Over 30 minutes you are on her nipples, and dude, you've got your hands loaded with lube, and you're like, today me and you breasty, and then you're on her nipples, working her breast, and doing other things and trying to be the man here. And now this woman is a high risk. It's got a high risk pregnancy. Maybe she's in the category of placenta previa, and all of a sudden the oxytocin level got so high and is engaging contraction. And because a woman with placenta previa should not deliver her vagina, so if at all you finally induce labor as a result of you trying to be the man, I'm sorry, but that particular baby may not come out alive. That baby may not come out alive, and if care is not taken, you may lose your wife, you may lose the woman. So this is the reason why, this is something that we should know, right? But many people don't know it. So if at all you have a wife and she is approaching her delivery date, you should be very meticulous to ask your health provider, okay, see this and see that. Should we continue in this regard? Should we stop? There are some people that are even asked to stop having sex when they're approaching their EDD, their expected date of delivery. So you have to also ask, is this safe? Even if your wife is not in the category of placenta previa or overreactive uterus, even if she's not in those categories, you still have to ask. It doesn't hurt to be sure. It pays actually to be sure before you do anything. So you have to ask, you have to make sure before you engage. I know you, bro, you love acrobatics on that. So even if you want to do the whole thing, I understand, but you have to ask. So reach out to your health provider, ask questions. We don't want a situation whereby you induce labor and it doesn't end well. All right, we don't want a situation like that. Nice having you. Subscribe, turn on notification, like, and of course all your questions you can drop on the comment section. I'll be very, very, very careful to answer each and every one of them explicitly. All right, thank you for staying up. Bye.